implementing programs to modernize healthcare, we set a goal to become more efficient, productive, and accessible to the public. And of course, we sought to enhance the quality of medical services. I believe that we have accomplished all of the primary goals we included as part of our modernization program for the Republic of Tatarstan. The most important thing we were able to achieve, in terms of both the medical community and patients, is a greater understanding of what is happening. Doctors and patients are already seeing some improvements. While the medical community was fairly cautious about the modernization program before it began, now doctors are becoming more enthusiastic, and we want people to move in this direction. We came here with a fairly large delegation. These days, in all regions, including Yakutia, there are problems with the use of IT in healthcare, particularly in large republics such as ours, which covers over 3 million square kilometers. Here, the role of information technologies in healthcare cannot be overestimated. Therefore, it is very important for us to introduce these new technologies in the field of medicine, as well as to share best practices and adopt advanced technologies for our republic. For this reason, we have very high expectations for today's conference. It is extremely important that we establish an electronic medical record. We must tackle the problems of the informatization for secondary, specialized healthcare. We should also intensify our work on primary areas associated with telemedicine, including home telemedicine. It is also worth mentioning that in terms of medical informatics as a science, we need to research thoroughly the systems for making medical decisions. It is a great honor to participate in such a high-quality forum. Even after just the first part of the conference, I can say that a lot has been accomplished and considerable progress has been made, and there are a lot of developments in the field of medical information. The Republic of Tajikistan, and particularly the city of Dushanbe, is currently in the first stage of implementing information technology. Some steps have already been taken, such as developing legal platforms for enhancing this network. I think that we'll use the experiences of Kazan, whose healthcare facilities we have visited, as a basis for implementing our own systems. Unfortunately, it should be noted that, given the lack of any regulatory system in the healthcare community, information has to be entered twice. First as a handwritten hard copy, and second into the information system, which provokes a negative reaction and raises a number of issues. I'm looking forward to this event as an opportunity to exchange opinions and contacts, and to get new ideas across a range of disciplines and interests. The modernization program in Moscow Oblast has led to a lot of positive results. Yesterday we went on a tour of Kazan, and we are very grateful for the hospitality of the Kazan Medical Informational Analytical Center, where we saw many interesting things. Interaction between a patient and a healthcare institution is currently only at the development stage. Right now, we only see the relationship between the insurance company, the territorial fund, and the healthcare facility. In this system, the patient, a citizen of the Russian Federation, should be the key link. But not enough attention is yet being paid to the citizen. We need to work on this in the future. A complex system such as the Unified State Information System will become the same for all of Russia, including the Republic of Tatarstan. There are problems related to the fact that every region works in its own way, whereas we should work together in discussing information technologies and comparing results. We work in the health resort business. Many of our Russian colleagues have presented the kinds of ideas that are already being implemented in Europe. Therefore, I'm particularly interested in using this conference to find out what's new in medicine in Russia.
Problems depends on the situation they happened and the ideas to resolve the problems and conflicts behind them. in a conference like TIH, it's important to learn the problems and learn the solutions and listen to what any type of problem in the health area has happened and how they did cope with the solution and apply the solution to real cases. With listening to the experience of the other peoples, we can learn new problems and we can understand some new solutions. And we develop it for our real cases.
Every conference is relevant to us and has a lot of advantages. We want to further our international cooperation, share our experiences, and see what will be presented here, what kind of materials, knowledge, and experiences are being discussed. All of that is of great interest for us. We have been working closely with the IT company Corporate Information Routines. We created a joint project that is coordinated and conducted through the All-Russian Research Society of Arythmologists and is gaining momentum at Russia's 15 largest clinical centers. Leading clinics of Kazakhstan are set to join the project as well. We have accomplished all of our goals. The conference attracted lots of public interest, and guests from many Russian cities and foreign countries came to participate. We had a very fruitful discussion on important issues related to research and applications in healthcare. That is the purpose of our conference, and it is why it has been held 13 times.